Hey guys, and welcome to another episode of the Kashif Booth podcast. If you're new here, each week I sit down with a guest and we discuss their career so far, the highs, the lows, and what's next for them. Today's episode is a bit different. I have a guest. Her name is Saadiya. We actually met through Bumble Bizz. Shout out Bumble Bizz, you know. We actually are both podcasters, and she has an amazing podcast called the Invisible Crisis Podcast, which really talks about her condition with sickle cell. And we bonded really well on Bumble, and we wanted to collaborate to talk about healthcare and, well, as a black woman as well, and the racism that it felt, what she goes through, but also the mental health, what we go through in the media industry. So yeah, welcome to the show, Saadiya.
Hi, thank you for having me. I'm very excited to be here. We are in a studio, which is exciting.
Yeah, this is so exciting for myself as well. Like, this is the first time that I'm actually recording an episode in a studio. Usually it's been via Zoom, because I launched my podcast at the start of 2021 and was doing it over Zoom throughout the whole period. And then in half of the second season I did, it was just with my contacts in America because it was easier and cheap. So I was like, you know what, I could contact all of my contacts in America and then do that. So yeah. So why don't you tell us about your podcast?
Yeah, so my podcast is called The Invisible Crisis, and essentially it was inspired by my own dealings with chronic health. So I have sickle cell anemia, which is a genetic blood disorder, and I'm sure we'll get more into that later on. But I really wanted to create a space where I could talk to other people who are dealing with health problems, whether that's chronic, physical, or mental. And I think health is one of the most important aspects of our lives. So I really wanted to just have a space to learn more about it and also understand the healthcare system as well, because I think there are things to do with like your geography, your race, your class, just literally where you're born that can impact the level of healthcare that you receive. And I think that's really unfair. So yeah, I just wanted to create a space for us to talk about that.
I think it's a really good space that you did create, because I mean, maybe I'm uneducated or it's not something that I really look into, but it's great to just know that there's podcasts out there which talk about your condition and the ups and downs of having it and what you actually face as a black woman in this country and has sickle cell. So what have you kind of experienced? Because you've had it, I know, since you were 3 years old.
Yeah.
So what's it been like?
Yeah, it's been a roller coaster. So I guess the way that sickle cell works, I'll give a very brief kind of like biology lesson. So essentially your red blood cells are circular, they're flexible, and they carry hemoglobin through your veins and your body and just help you live your best life. If you have sickle cell, then your red blood cells are deformed. They're not fully formed. So they carry like half the amount of hemoglobin, first of all. So you're very anemic. And also they are sticky and rigid and they don't flow through blood vessels very well. So when that happens, you go into a crisis, a sickle cell crisis, and that can be very painful and you need like urgent medical attention. In the UK, it's one of the most popular genetic disorders. However, I have been in hospitals where doctors have never treated anyone with sickle cell anemia. They don't know what to do. They will call the next hospital and be like, hey, we have a patient with sickle cell. What should we do? So yeah, it's still something that's very much, education is still needed around it, even within the black community, but also, in white communities as well. Yeah, and my experience, it's been hit and miss. I think, I remember one of my earliest memories is my mum calling an ambulance because I was having a crisis and I needed medical attention, and that the paramedic kind of blaming my mum for wasting their time, because they were like, oh, she's absolutely fine, she's just a child and she's just crying, there's no need to call an ambulance. But obviously, I think a lot of the time it's been proving that you are ill and that you deserve attention, which is a weird space to be in. So yeah, it's had its ups and downs for sure.
I could imagine. I mean, I don't have a chronic illness, but I mean, sometimes I am very, not skeptical, but I have to make sure that I have my third eye on when I go into a hospital. So, for example, my mum, she had her fibroids removed in 2019. So, after hearing all the horror stories that black women have gone through when they go to the hospital, even though yes, NHS is free, but the racism that black women specifically are facing
Yeah.
in hospitals, I was like, hey, my guard is up. Okay. So anytime, yeah, you want to step out of line, yeah, I'm ready. Like,
Yeah.
you know, and luckily she was okay. And
Yeah.
she had a great healthcare, and the nurses were great, the doctors were great. So she didn't actually face that. But it's very sad, and it's a shame that that's something we have to actually think about, you know. And it's like, oh, okay, your mum called the ambulance because you were having an episode and you didn't know how to really respond to the pain in a way, in a quote unquote correct way, because you were a child, but they're upset that you wasted your time. But how's your mum supposed to know? She's not gone to
Yeah.
medical school, and she's not done a residency to understand. So how's she supposed to cope with that when you're having such intense pain, you know? And
Yeah.
there's no real compassion sometimes.
Yeah.
And again, it's like that. I think, correct me if I'm wrong, guys, don't shoot the messenger, but I remember, I think there was like a study done that how black people have like a tolerance to certain levels of pain. So it's like they just feel like, oh, she's fine. Like they don't, even though black people are telling the doctors, no, I'm actually in real pain, I need help, and they just say, no, it's okay, you'll be fine. But it's like, how can you base one study on one black person on the entire race? And that's something that we continuously face. So yeah. So doing your podcast, what have you actually learned through the guests you've had on there? What have you learned from it?
Yeah, so I'm currently recording for season 2, but in season 1 I had a range of people. I had people with sickle cell anemia, and I talked to people with other chronic conditions as well. Um, I think the biggest thing I learned was how the physical can really impact the mental, and that's something I've learned in my own life as well. Um, I think because with sickle cell, I have a very like get up and go attitude. I'm like, right, okay, I'm in crisis. I need to like take my medication. I need to go to the hospital. I need to like do all these checks and just get through it, because then I can get to the other side and I'm fine. But then it's taken me maybe like 10, maybe like 20 or so years to get to the point where it's actually impacted my mental health. And I'm so tired of the constant like going to hospital, taking medication, getting my bloods done and stuff like that. So listening to other people with sickle cell and other women with chronic conditions, I've just learned how big of an impact the physical can have on your mental. And I think this is something that we all know, but just to hear about other people's experiences as well has been very enlightening. So yeah.
That's good to hear. And I know on your podcast, you don't just talk about sickle cell, you actually talk about other healthcare issues within the industry, but also other chronic illness. What else have you actually spoken about on your podcast?
Yeah, so let me think. I've spoken about sickle cell in terms of the workplace. So how do you actually have that conversation with your manager that you will need extra time off for medical appointments or whatever? I've spoken to a woman who had, I think it was, okay, this is bad because I should know, but it was like chronic pain and chronic fatigue, and she was bedbound for a year, and she was also Muslim as well. So we talked about the kind of how her faith helped her get through that. So yeah, I think obviously like illness is an important topic for us to discover, but there's so many like touching points and elements that are impacted by the fact that you're ill, whether that's physically or mentally. So yeah, I really like to kind of like dive deep and connect it to other parts of our lives as well.
That's really good. So what do you do for work? Like, how does your job balance you having sickle cell? What is that like?
Yeah, I would say I'm very lucky to be able to work from home. So I work as a consultant. It's desk based. It's 9 to 5, Monday to Friday. Um, and honestly, okay, I understand that the pandemic was obviously um, it was very difficult for everyone, myself included. But I found that by being home and working from home and having the flexibility to do that, I was less ill. I think because there was less stress on my body with the commute. Commuting in winter is obviously not great, but for someone with sickle cell, it's even harder because the cold is one of the biggest triggers. So um, I'm lucky now that my job allows flexibility. However, I have not been as lucky in the past. One of my first jobs working in a call center, I was let go because I had taken too much time off ill. I remember like my previous jobs, like being like really struggling with that kind of like the constant commuting and the impact that was having on my body and feeling more like drained and tired at the end of the day. So yeah, I'd say at the moment I feel very privileged to be able to work from home, and I know not a lot of people can say that. So yeah.
That's actually the benefits of the pandemic, you
Yeah.
know, that how we've been able to, well, lucky for some, not me. I've had to be more so remote in office and then sometimes at home. But that's the benefits of working from home. And that's why a lot of people are saying, well, you know, we really need to be working from home more because
Yeah.
we've actually shown that actually you can get more work done if you're actually in more of a comfortable environment and
Yeah.
not having to commute to work with all different weathers. So that's good to hear as well, that at least you're in a position where it actually benefits you and your health condition as well. So that's good to hear. So I mean, one thing what I wanted for us to speak about actually on the podcast was really talk about mental health as well. That's what I wanted to collaborate with you on. And so how does mental health affect you as having a chronic illness? What would you say have some of the things you've faced as well?
I would say it's just a lot of pressure, I think. And it's a lot of just the constant cycle of like being well and then something happening. So again, with sickle cell, there were a lot of triggers like the cold, stress, like there's quite a few. And doing something like going outside without my scarf on, and that small action can like trigger a crisis, and I'm in hospital, and then I'm like, oh my goodness, why did I do that? That I'm so stupid. Like it's just a constant like negative self-talk, and also the like, if I could just go back in time and just take my scarf in the morning, then I would have avoided all of this. So yeah, it's the constant like trying to like strategize your day as well. And also just like it's tiring and it's exhausting to be physically ill all the time. And mental health, I think, resilience is a word I think a lot about. I don't know if you would describe yourself as being a resilient person, but I think there's only so much a human being can take, right? So as much as and I think especially, I don't know if you find this, but like within the Black community, the idea of being strong and resilient is such a big thing, um and it's so tiring, and it's it's hard to be quote unquote strong all the time or resilient all the time, and it can really take a toll on your well-being. And if people expect you, like, I don't know, if you as a Black man, if you feel that you're expected to be strong, or even as a woman, the strong Black woman, if you're expected to be like that, when you have your moments where you're not, you you don't know what to do. You don't know who to turn to. So yeah, I don't know if you've ever, like, when we're talking about mental health, I don't know if you've ever experienced.
I think I have. It's something where I'm always expected to be the person to be the bigger person or to make the first move in a situation. So even if it romantically, friendship wise, family issues, or to be that person to give advice, or to be the person to mentor or to guide somebody else. I'm always that person to somebody can call upon or actually can be able to get I'm trying to think, like, just I'm always that person, the go-to person.
Yeah.
And that does have a toll on my mental health because it's like, well, who's going to be there for me?
Yeah,
You know,
exactly.
who's literally going to be there for me? But sometimes people say to me, oh, but you don't open up to us, like you don't actually give us a reason for us to do that. But it's like, have you thought that maybe you've not given me a reason for me to feel like I can be comfortable to open up to you? Because if you're just taking, if I do, are you going to be receptive to what I'm saying, or are you just going to brush it away off? And that's something that you do face as well. And I think when you're saying about, you know, being a strong black woman, and that because we are, well, I think black people in general, and particularly black women, you're taught to just, you've got to just take it on the chin and just get through it. Like, and then, you know, older generation, you're being told, well, I had to do all of this and blah, blah, blah. And so you can't do this little thing. It's just like, well, okay, well, I'm sorry you had to do that. But maybe we're not all mentally as strong. Allow people to be vulnerable. Allow people to actually just be able to voice their opinions, and then able to shout it out. And then, you know what, tomorrow I can feel better. Let me sleep on it and then get better. And that's what we need to have more of, especially when you're going through something which you can't even control.
Yeah, so, exactly. Yeah. And I think the idea of being black, so you mentioned that study of medical professionals thinking black people are stronger. And I think that is really dangerous, because when you are in a position where you need medical attention and your doctor is like, oh, you're black, you're fine. Like, no, that person like needs, they are in A&E, they need like urgent care, and you can't, there's no space or there's no room for stereotypes. Like, you need to treat them at face value. So even like, obviously within our communities, but within like the general population, and going to A&E, that view of black people is very dangerous as well. So yeah, it's,
but I also feel like it's the way the NHS are really kind of operating in their system of how they operate, in terms of like filtering through appointments. So last year I was suffering with a hemorrhoid, and so I was bleeding, and I literally was saying to my doctor, like, you know, I've taken the medication, I've done the treatments, and it keeps coming back. And then she said, literally word for word, she said on the phone to me, and what do you expect me to do about that?
oh wow. Okay.
And I was like, you know, when you take a moment and you're like, wait, what? Like, I'm literally telling you the reason why I'm calling you and what I'm concerned about. Okay, you are the doctor, and you may think, oh, this is mundane. Like, why are they calling me about this? But how am I supposed to know? I'm not a medical professional. It's your job to actually to tell me everything is fine. I know it's been a recurring issue, but it's actually fine. Just do this. That's what you're supposed to do. How can you actually say that to somebody? And that's the issue I think we face now. I don't know if she checked my chart and saw that I was black, or if it's just that they're just like, you know, well, okay, lunch is coming. I just want to like get through this, you know. And that also has a toll on your mental health, because then you makes you think, well, okay, well, even though I'm feeling sick, or there might be like a lump here, or I'm not going to call the doctor and make an appointment because it's not deemed as an emergency. So you've got to, when you call them up now, it's like, okay, I've been like having heavy breathing and like I've shortness of breath and I need to like speak to someone immediately. You know, why should we have to do that? You know, and that's the problem. And I'm not saying that's because of COVID. I mean, this was before COVID. So I don't know. So yeah, it's a very tricky subject at the moment, but I just think that if we actually want to have that support from the doctors, they literally have to show us that they care and they actually are being attentive. That's why so many people, I think, especially in the black and brown community, don't want to take the vaccine, because they're just looking, well, look what you've done in the past. Why should I trust you now? And you can't really argue with it. Like, I can't. I just feel like, well, that's your decision. If you don't want to take it, you don't have to. I feel like everyone should have that option, but that's something that they need to improve. They need to build better relationships with black people, brown people, people of color, to be able to show that they care. But then, like you said, if they're constantly being dismissive of what we're saying, then we're just going to continue that cycle.
Yeah, exactly. Yeah, I'm actually shocked that your doctor replied with that, because that's very, I mean, yeah, you wouldn't expect any healthcare professional to do that, but it just goes to show, I think, if you get that response, why would you go back, you know? And you're right. I think a lot of the times people wait until they are out of breath and they've got chest pain and they're like almost fainting before they reach out to their doctor. And it shouldn't be that way. You should be able to have a conversation with your healthcare professional and be able to trust that they have your best interest at heart in the same way that they would have their own best interest at heart. So yeah, I think it's really important for us to have those conversations amongst ourselves within the Black communities, but also just in general, to be able to feel empowered to go to your doctor and say, actually, I want you to do this test. Actually, and I think obviously there's like, um, there's a view that people can like go on Google and diagnose themselves with like cancer or whatever. So I'm not suggesting we do that, but like being aware of just your rights, I think is really important. And replying to your GP and saying, actually, I want a second opinion, or I've made a diary, I've listed every time I've had pain. You know, I'm not crazy. Like, I want you to treat me. So yeah, just feel empowered to reply to your doctor and say, no, this is your job, so help me.
It's true. And this is why I think there's like a domino effect, because when people talk about mental health, I feel like it's now also seen as like a buzzword, like, oh, yes, my mental health, and some people don't really take it seriously. So when you're actually talking to your local GP and that's what they're doing, that has effect on your mental health on top of the illness that you have as well. So it's like, you can become fearful, you can become anxious, you don't know what direction to do, and you probably internally you're actually making it worse for yourself. But then also it's a thing where it makes me think about how the media reacted to Simone Biles and Naomi Osaka last year, where they pulled out of tournaments or the Olympic competitions because of their mental health. And it's like, well, it's actually a real thing. Mental health is something which people just like to sweep under the rug still, because it's just seen as, oh, you need to, like we were saying before, oh, you need to suck it up, you need to be tough, like, oh, the other sporting champions, they didn't do that. But like when you used to see like a sporting legend have an embarrassing loss, you're like, oh my gosh, how did that happen? That's because their mental health was atrocious, but nobody was talking about it. Nobody was seeking therapy to actually work out what's going on in your mind, to actually see what's going on, why is things not connecting, the pressure, anxiety, and those are the things what really kind of add up. But then you have people like Piers Morgan, who goes up online and is writing all these articles about how they need to basically like, be a man or be a woman. And it's like, that's not what you need to actually sell to people. And it's like within the media industry, it's like with social media and the way everyone has an opinion on something, and then the way that it's a domino effect of it having an effect on your psyche, and then it just triples down. And people don't actually realize how when you do that, that's what stops you from talking to people. So like you was asking me earlier about, as a Black man, how do I feel like I need to be strong? Yeah, you do need to feel like you need to be strong. Just like with Regina King's son, who recently committed suicide, it's like, he was only 26, and he felt, even though he had such a close relationship with his mother, he didn't feel that he could speak to his mother about what he's going through, or feel confident to go and speak to a healthcare professional, because it's taboo. Oh, you're going to see a therapist. Oh, are you crazy? But no, he decided that, oh, it's better for me to just commit suicide. And those are the things what people need to speak about. And when I think about my industry, in the TV and film industry, like the amount of racism we go through, and sometimes because it's such a white dominated field, as much as they talk about diversity, listen, we're still like 20 years behind, it feels like sometimes, because even in the award show I went to last week, literally my friends and I, there were 4 of us, and then another person who won an award. We were the only Black people in attendance / people of color. So so it's like when you're constantly in that environment and are facing microaggressions and and this subtle racism and stuff like that, and you're being told that diversity matters, but then you're still not seeing yourself represented. It's like, how are you supposed to feel included and accepted? But so this is what we're saying, that mental health, all different type of healthcare is important. And so when we're talking about these things, it actually needs to be heard, and actually something actually needs to be done about it. But we'll see if there's change within the future. But as somebody you're kind of in and out of hospitals all your life, would you say that you've benefited from having a Black doctor? Has that made a difference in certain situations?
I don't think I've ever had a black doctor.
Wow.
Wait, I've never thought about this. I've had black nurses for sure. But like a black consultant,
Mhm.
I don't think so. Um, but sickle cell, I think so. Actually, yeah, I saw a TikTok the other day about how even by saying sickle cell is a predominantly black condition is also kind of limiting because so basically the countries that see people with sickle cell are countries with malaria. So people within the Mediterranean, people in India, South America, there are people there who have sickle cell as well, and they're not black necessarily. So again, moving away from seeing it as like, oh, it's a black problem, I think is really important. But then at the same time, I am a black woman, and when I am going to A&E, they see a black woman. So yeah, I think it's definitely impacted healthcare for sure. Um, yeah, that's a good question. I don't think I've ever had a black consultant. Um, but I don't necessarily think that that's a bad thing because the consultants I have had have been really passionate about, helping me. And yeah, I think, yeah, I don't know.
Well, see, hey, you're stumped. So maybe who knows that in the future, if we do have more people who look like us in that room,
Yeah,
maybe then there might be actually some sort of change and actually a difference in the experiences that you face as
yeah,
in being in that environment as well.
yeah.
Because I wanted to also ask you, like, what has being having sickle cell, how has that affected your friendships or dating? What's that? Has it affected that?
I think it has, probably in ways that I don't really realize. Probably more subtle ways. I think with sickle cell, it's very, I can make plans on Wednesday, and then by Saturday or Friday, I'm actually really not feeling well and I have to cancel. So there's a lot of that. There's a lot of like having to like put myself first, which, you know, I think if a friend doesn't really understand the condition, it can be hard. And I'm constantly having like whenever I meet new people and they become a friend, or like if I'm dating someone and it's getting serious and like having to explain it, I'm just like, I wish you could just go and Google it yourself so that you know, and I don't have to like talk to you about it. Because even that again can like be a drain and a mental drain because yeah, having to like retell those stories, and like there's one thing in doing it for awareness, but there's another thing when it's so like personal, and it's almost like I want you to know how serious it is, but I don't want you to think any differently of me. So
Yeah.
yeah, it's like a balance.
So what do you think will be the correct way, or what way do you think will be impactful to actually change the perception of mental health, or just when people are talking about health, the health industry and healthcare, what do you think can actually be beneficial to actually make some sort of change?
Um, I think just allowing space for people to openly talk about what they're going through without judgment. So it's interesting when you were sharing your experiences about working in film and TV, being a creative, and dealing with mental health. I think in any working environment, you will have challenges as a Black person, especially in this country. I've never worked in a place where, maybe actually apart from one place where I wasn't the only Black person in a team. Um, and that in itself can really, yeah, impact your mental health, as you say. And I think, especially with TV, and this is just as someone from the outside, there are movements and there are like, okay, this is the season where we're going to like um, empower Black voices, and we're going to like have Black people as like the main character in the show, and yeah, Black History Month and stuff, which is good, but it feels like trends throughout the year. It doesn't feel like
Yeah.
it's ingrained in the fabrics of like society or your industry or my industry. And I think, yeah, I think getting to a place where it's just normal and we don't necessarily have to like having the conversations is important, but we don't necessarily have to be shocked that Black people are still facing microaggressions. I don't know if that makes sense, but like, of course, Black people are facing microaggressions because they're working with people who maybe have never interacted with a Black person before. Maybe they like have this weird preconceived notion of what Black people are like, and then you have to work with them and you have to have a meeting with them and you have to like potentially promote them. Like, there's a disconnect there, and I think getting to a space where it's normal. I don't know what that normal will look like or how we'll get there, but I think that's really important. And then on the mental health side of things, yeah, just creating space for people to talk and for it, again, to be normalized that we have mental health struggles. And it's hard, I think, especially as you mentioned, Regina King's son. You know, you can, I'm sure, like you said, they were really close and there was like a safe environment. It is hard, and I don't think any one person has the answer. But again, just reassuring that individual that, hey, if you ever need someone to talk to, and it could just be like a passing comment that you make to someone. Yeah, I think it's lots of different things, to be honest.
No, it's so hard to unpack. And I think, when I think about working in the TV industry and, you can work in predominantly white spaces and be fine, but then also it's even like, for example, I worked at a job at ITV Studios many years ago, and it was predominantly white and female women that I was working with actually. And that was the second time actually. And both times were hell. And it was very interesting because I'm a person who's very organized. I anticipate what needs to be done. Like, I'm quote unquote, you're not your stereotypical man. So, there's that stereotype of that, oh, men can't multitask and they can't do this and that. And that's me. I can do multiple things. Like, that's just me. And sometimes when you're working in that environment, it's like, I think some people, when they are deemed as other or because they were women, so most of the time in a corporate setting or predominantly male dominated environment, a man would make a woman feel less than, or sexual harassment, or but sometimes there's some in that in those environments, that's how I was feeling. So it's like, you're making me feel how men have made you feel. And it's like, if we actually want to have equal playing field, you don't repeat what somebody else has done to you, because then there's no way we're actually going to make some change. And so that's where it does. I remember it didn't affect my mental health at that point, because I was like, do I really want to work in this industry anymore? I started to doubt or forget, like, why did I want to do this? It just feels like a job. It just feels I don't need to put up with this. But then it actually was a blessing in disguise, because it then actually motivated me to do stuff outside of work independently, just to see how I would feel if I still want to do this. And it reignited my passion, and then actually that led to me launching my own company. So it's so weird how you can go through certain things, but not everybody has that mental psyche to be able to even figure that out. Somebody could just go down a rabbit hole and quit, and then next minute it's like been years gone by and they regret it because of one bad experience as well. So I think it's more so about having safe spaces, like you were saying, about where we can actually speak about these things. But then also, in reference to like Regina King's son passing away, it's not even just about, I think, talking or saying, oh, if you need to talk, you can speak to me. I think it's also about raising your children or creating an environment with your family, your friends, where actually that we let go of gender norms, we let go of we let go of kind of stereotypes as to how people are supposed to be, and actually accept people for who they are and make them feel that they can be comfortable to talk to you about anything, whether it's their sexuality or anything they're going through. For example, like, so if you're like, you've got a friend and they're like really conservative and they don't, okay, I don't want you, well, they don't like the LGBT community, or they don't like, people who are, of other races and stuff. No, if you're in that type of environment, you need to let yourself go.
Yeah.
So then at least if you're around that, then that's not going to be good for your mental health, because the people all are against everything who you are, for example. So I think it's about, if you've got a friendship group, or if you've got a family member, or your whatever community you're in, if you actually are in a place where everyone's accepting, can't even speak, accepting of everything, I think that can create a better environment.
Yeah.
But at the same time, that's still just easy to say, because the person has to be comfortable with themselves, with whatever they're dealing with, to be able to share that anyway. So it's just, so there's so many different answers. Like there's no way where you can really put it. So
yeah, definitely.
So
I like what you said about the gender norms. Actually, I think that's a really important point, because I think we can sometimes get stuck in like, oh, women should do this and men should do that. And even within like feminism, I think we think feminism is just for women, but actually it can help relieve men of, oh, a man should be like this, a man shouldn't talk about his emotions and blah blah blah. There is no should when it comes to being. So yeah.
Well, on that note, I would like to say thank you, Saadiya, for joining me on my podcast, especially my first one in the studio. So I mean, where can people find you on like socials or your podcast to check it out?
Yeah, thank you for having me. It's been very exciting. So you can find my podcast on Spotify or Apple, which is The Invisible Crisis, or you can follow me on Instagram at The Invisible Crisis Pod as well.
Well, great. Thanks again for joining me. Thanks for guys for listening. Hope you enjoyed it. It's a very different episode to what you've heard on my podcast. So as usual, follow me on all my social media at Kashif Booth or Kashif Booth Entertainment or the Kashif Booth podcast. Stay tuned for new episodes coming soon.